conversation. We're talking all about asthma and other things related. Okay, so jumping right into the conversation this morning. First, I'd like you to give us like an overview on, exercise and asthma as a fitness expert.
Okay, so for persons that are asthmatic, most of the times, due to the symptoms that showcases for asthma, there is this fear of carrying out physical activity.
Okay.
But truth be told, people that are asthmatic to actually need fitness or a form of exercise consistently in order for them to, live a better life, help them with stress, and also sleep well. Asthma refers to an inflammatory disorder of the airway. Now, this happens to people that are vulnerable with their genes.
Okay.
You understand? And it's about, let's say, 12 to 16% of our society, we have people that are asthmatic. Now, asthma varies when it comes with the attack because they have different episodes of attack that can happen to you almost anywhere, anytime, without you even getting to see it, coming. We also need to understand that the symptoms it comes with, there are things that actually bring about that symptoms.
Okay.
So the kind of symptoms they have is like, when I say tight chest, they have issues with breathing. It might even lead to respiratory failure. In the worst scenario, they always have issues with wheezing, and these are symptoms of asthma. However, the trigger mechanisms of these symptoms can be stress, lack of breathing in good air. You understand? If you find yourself in an environment that is polluted, the kind of air you breathe in can also trigger asthma. Another thing that also triggers asthma is called exercise-induced bronchoconstriction. As a result of carrying out physical activity, an asthmatic person can also get the asthmatic attack. That is why you have to work with a fitness professional that understands how to guide you on the kind of workouts you need to do and the parameters you also need to work with. Go ahead with your question.
So let's talk about those types of exercises, that are generally safe and recommended for people with asthma. So are there like a specific set of exercises like push-ups or a specific type of weights that you can carry, while having asthma that you can still use to, stay fit?
So I will just drop the basics. For someone that is asthmatic, it is known that the person needs to build exercise exertion over time to get used to it. So the kind of training for someone that is asthmatic is more of exercises that has to do with endurance.
Okay.
An example of it is cycling. Can be taking a long walk, can be jogging, can be swimming, but then not in a chlorinated water. If you are swimming, the water that you should swim in should not have any form of chlorine, because chlorine also triggers asthma. So that is why if kids that are asthmatic, without having knowledge of the fact that they are going to the pool and the pool
it's been treated
it's been treated with chlorine, you go into that pool to swim, you're going to have an episode of asthmatic attack. Good. Now, because of this knowledge and also knowing that you need to build physical exertion over time, that is why the kind of trainings you need to do are endurance training that will take a longer period of time. An example I will come again is swimming. If you're going to swim, you realize that you may swim 15 minutes, you come out, you chill for like 5-10 minutes,
and then you
go back into the pool again. And now this is how your kind of exercise routines will be. Another one is cycling. I said that earlier. Imagine cycling for like, let's say, cycling round. If you're staying in a very controlled environment, you cycle around your environment once, you get to cool off for like, let's say 5 minutes, you still continue cycling. That is how it helps asthma. Asthma does not really have a cure. Truth is, you would have to modify your life so that you can manage the symptoms, and the symptoms should not exceed what you're already experiencing, and you can mitigate it at the level you are already experiencing it. So for people that are asthmatic, it is advised that you have to carry out a form of physical activity consistently, so that you can use it as a form of lifestyle modification to manage asthma, as well as live a healthy and active lifestyle.
All right. I love that. For those out there that are asthmatic, but they want to get into the fitness lifestyle, what are some of the, I know that you've mentioned, routines for exercise, but what are the precautions that they should, and preparations that they should, take when they're trying to, get into some fitness exercises, and other things related?
All right. Nice question. So for people that are asthmatic, first of all, you don't joke with your medical practitioner. You already have a medical doctor that works with you.
Okay.
You are going for rigorous kind of test. You are on different kind of medication to suppress the attacks. So you have to ensure that first of all, you have a permit from your doctor to carry out physical activity.
Okay.
Then you move over to the next level of getting a fitness professional who can now guide you on the level of intensities, because for asthma we're looking at the intensity of how the routines will be. So it's not really advisable, if you're not knowledgeable of how to go about it, to just go about working out. As much as a doctor has given you the permit to go ahead, you now meet up with a fitness professional who will now guide you, and also you work on your nutrition. There is no better active lifestyle without nutrition. So as much as we're bringing this lifestyle modification to help you live a better life amongst every regular individual in the society, you need to ensure that you are eating very well. There are foods that will trigger it. I know that they are not fine with eating food that has oil in it.
Okay.
Because this is issue that has to do with your airways. So you have to be conscious of what you take in and the kind of food you eat. That is also where it brings me to you meeting with licensed dietitians that will advise you on the kind of food you should eat. I also have experience with people that have been asthmatic that outgrew it. One thing about asthma is it is very possible, it is likely that over the years, when you apply this lifestyle modification, you can outgrow.
Things start to change and you outgrow it.
Your heart health, your pulmonary region, your respiratory system, they will begin to adjust to this lifestyle modification. And over the years, it has also shown in the testimonials of people who have been able to outgrow asthma.
All right, and I'm glad you mentioned testimonials, because that's one of the ways we're going to wrap up this side of the conversation. Are there success stories, and also I'm sure that there are people out there listening to the radio right now who have some type of asthma and are looking to still get into the fitness thing. So how can they contact you?
So for those of us that are asthmatic, please put it at the back of your mind that you can carry out physical activity. As much as, yes, one of the major issues they experience is breathlessness, and as a result of that they'll be thinking, if I'm unable to breathe correctly and then I'm carrying out physical activity that will literally elevate, will I be able to do it?
Yes.
This is where you now have the right guidance. When it comes to asthma, one of the major ways of lifestyle modification that can help you to live a better and healthy active lifestyle is you carrying out physical activity. I can put it to you. We have Olympic gold medalist in the US, Jackie Joyner, if I'm not mistaken with her name. Yes, she was diagnosed with asthma and it did not stop her. She was an Olympian with asthma and can win gold medal. That means that anybody or any regular person that has asthma can carry out physical activity, even if it is not in the extreme. You have guidance. So always watch out for yourself and always be the best of yourself.
All right. Thank you so much, Big Harry from Healthy Fusion.